Hey there, this is Dr. Evan Osar of Integrative Movement Insider. Welcome to video 2 of this video series, Best Core Exercises for Individuals that have low back pain. Recall that in video 1 we talked about the biggest myths surrounding exercise and low back pain. If you missed that video, make sure you check it out because this information builds right off that information. Recall that the myth of the weak core really is around the idea of that individuals don't have a weak core, rather they have a non-optimal strategy for expressing their core strength. One of our go-to assessments is the lying in happy baby position with legs on the wall, lifting the legs off. Because what this assessment really tells us, and this is what we use with all our clients and patients, this assessment gives us information on whether it's a weakness issue or a non-optimal strategy that's causing and driving our clients' issues. And that really relates to whether we're talking about low back pain, SI joint pain, hip dysfunction, and or other dysfunction in the body. What we want to see, what we ideally want to see that tells us whether it's a weakness or non-optimal strategy issue that's driving our clients' issues is when the client lifts their legs off, what happens to their core. Number one, can they lift their legs off? Number two, what happens to the core? And is it optimal or non-optimal? What we're really looking for is when the individual lifts their legs off the wall, and this is a very low level exercise for most individuals, or should be, I should say. It's not for most individuals, but it should be a low level exercise, meaning it doesn't take a lot of effort to do this exercise. But what we're gonna see is many of our clients, and again, this is my 17 years in practice working with thousands of individuals with low back pain. What we've seen in virtually every single patient and client that comes into our office, when clients have a non-optimal strategy and they lift their legs off, and this goes for your unhealthy individuals or individuals that don't work out to your most fit individuals, when they lift their legs off the wall, they do not maintain their alignment. They do not maintain their control of their TBC or that thoracopelvic cylinder. Let me demonstrate what this means and what it looks like when our clients have a non-optimal strategy for lifting their legs off the wall in this relatively easy type position. So if the clients lie down and they're going to place their feet up against the wall, about shoulder width apart. We're going to get them as lined up as possible, as they can possibly be. Now the first thing we have our client do is just take a couple deep breaths in. So we watch how they breathe, because remember, non-optimal breathing will also lead into a non-optimal strategy. So we also get information about their breathing. We get information about their alignment as well. How well can they actually line themselves up in this position? Then we have them lift one leg off the wall. And how much shift of their pelvis or their body weight do they have to do to get that leg off the wall? Again, you should be able to lift, your client should be able to lift their leg off the wall with no problems. That's usually the easier side. The challenge comes when they lift that second leg. When you have an optimal core stabilization strategy, the opposite leg will come off, the second leg will come off the wall, and there will be virtually no change in the alignment and or what's happening through their abdominal region. So let me do that again. So when that second leg comes off the wall, number one, we're looking for the ability to get into the proper alignment. Number two, how well do they lift that first leg off the wall? Number three, how well, more importantly, does that second leg come off the wall? And there should be no change in the alignment and or how much distension or bulging out of the abdomen, and there should be no change in the chest, shoulders, head, or neck. So once more, put the client down, feet about shoulder width apart. A couple deep breaths, observe their breathing strategy. Number two, have them lift one leg up off the wall. See how they do with that. It should be very easy to lift the first leg. What we're really looking for is that second leg. How well does their core stabilize against the lift of that second leg? There should be almost no change in that alignment. There should be no distension through the abdomen. And there should be no change in their ability to breathe. They should be able to talk and have a conversation in this position, and then place one leg back down, place the second leg back down with no change in their alignment and no change in their ability to communicate with you. That's an optimal core stabilization strategy. Here's what clients will do to tell you they have a non-optimal core stabilization strategy. They will lift one leg up.
Clients will struggle with that, but it's really when they lift that second leg up, you'll see a couple things happen. Number one, they'll get pulled towards their feet. So as soon as that second leg comes up, they'll get pulled off and towards their feet because they're not able to use their abdominal wall to hold them in intra-abdominal pressure, to hold them stable against the weight of the second leg. The second thing you'll see happen, or common thing you'll see happen, is they'll lift up one leg. As the second leg comes up, they'll distend that abdomen. The abdomen will just bulge out. That's a non-optimal strategy of controlling pressure, where they're just doing a Valsalvas or bearing weight down to hold their legs up in that position. Again, a second sign of a non-optimal strategy. The third sign you'll often see is you'll see them as the second leg comes up, they'll change their head position and they'll get pulled towards their feet. So again, you're looking that they can maintain optimal alignment. There's no distension of the abdomen, and there's no change in the alignment, and they don't get pulled towards the door or towards the wall. So if they can get their legs up, they have strength. Strength is not their issue. What they have is a non-optimal strategy when they show you these signs of bulging abdominal wall, or even a diastasis recti, or shoulders coming forward, head going into extension, and getting pulled towards the door or the wall. So that's how you really differentiate between whether it's a strength issue or a stability issue. So that's why it's so important to not make those common comments to your clients that you have a weak core, because then you start giving them strengthening exercises and they don't need more strength. The strength just builds upon the dysfunction. So what do you do for clients? What exercises do you do with your clients once you develop a better strategy? We'll show you in the next video. We'll take you through one of the common exercise patterns we use with our clients in the next video. The most important thing is to use those components of alignment, those principles, alignment, breathing, and control, to help them develop a more optimal strategy. Then you build them up into the core exercises or the fundamental movement patterns. Because once you align, breathe, and control them, then every exercise becomes a core exercise. So stay tuned for the next video where we discuss how to develop a more optimal strategy. And then in the third video, we'll look at how do you help your clients use this concept in a higher level pattern. So now we're going into how we help our clients and patients develop a more optimal strategy. Remember, the key components are the three principles of the integrative movement system, ABCs. Alignment. We must teach our clients how to align their TPC, and we must teach them how to breathe to control the intra-abdominal and intrathoracic pressure, which really develops that stabilization and also helps decompress the trunk, spine, and pelvis. And then we teach them how to control it, how to use the myofascial system appropriately around the TPC to maintain that alignment and also maintain breathing. So I'm going to set myself up in the proper position. Some of our clients will need bolstering support. Some of our clients will need to have soft tissue release prior to helping get into a more optimal position. But you can often do a lot of work just by maintaining some certain components of the proper alignment. So have your client lie down, feet up against the wall, about shoulder width apart. Pelvis should be relaxed in an anterior pelvic tilt. Hips should be relaxed. There should be no gripping or tension around the hips. Have the client gently elongate their neck from the back as if it strains from the top of their head, pulling them this direction on the table. They should be relaxed through the shoulders. Shoulders should be open and wide. First thing, so we got our first component, the alignment. Next, we want to go into three-dimensional breathing. So we want them to breathe into their abdomen, breathing in through the nose and out through the mouth. Relaxing the ribcage in between each breath. Keep them open and wide. Breathe in through the nose and out through the mouth. Making sure they fill up their entire abdomen. They also want to fill up their chest. So I want them to breathe up into the ribcage, laterally into the ribcage and chest. The chest should rise and open laterally, anterior, posteriorly, and laterally. So breathe in. So you should see expansion in the abdomen as well as the ribcage. So the chest and lateral components of the ribcage. Now I'm going to breathe back down into the table to get more of that anterior posterior component of that three-dimensional breathing. So now I breathe and really try to open the ribs into the table or the floor, in through the nose, out through the mouth. You want them to inhale about 3 seconds, and exhale up for about 4 to 5 seconds. So the exhalation takes a little bit longer than inhalation. You want them to slow their breathing down so they can really fill up the entire thoracolpelvic cylinder. And breathe out. You want to make sure it's effortless. You don't want them to strain during their breathing. Now, once you get a few minutes of good breathing, have them relax and breathe normal. The next component to this is bringing one leg off the wall. So you're teaching them to breathe and maintain three-dimensional breathing as they start to introduce a load to the spine, the trunk and spine. So they're going to lift up one leg and continue to breathe three-dimensionally. There should be no change in their ability to breathe as they lift that leg up. If you see any distension, shifting of the body as they lift that leg, over using the shoulders, changing their head and neck position, that is too high level for them. So they continue three-dimensional breathing. And then you can repeat on the other side, so alternate each side. Inhale, lift the leg. Exhale, put the leg back down. And you just kind of do a slow marching. There should be no change as they shift from leg to leg. As they progress, now you can start to have them start to work on gently lifting the other leg up. And again, remember, there should be no change in the alignment. If they're bulging out, if they're arching their back, if they're gripping their shoulders, if they're changing their alignment, and they're creating a diastasis recti in this position, then it's too high level. This is not where you progress them to. So again, if they can get here with no change in their TPC alignment, their head or neck, shoulders, they're able to maintain this, have a conversation, continue the three-dimensional breathing, this is a good pattern to work from. And now slowly relax after a few breaths. And now you can always challenge this pattern. So once they get good at this pattern, alternate which side comes up first, and now you can start to do heel drops. So dropping back down, alternating legs going towards a wall. But again, there should be no change in the alignment or for them to have a conversation with you as they're doing this pattern. You can also challenge it with the arms going overhead. So you can challenge the arms going out the side and or overhead, teaching them how to use the core, maintain three-dimensional breathing, and maintain neutral alignment. So that way, you're teaching them all the principles that we discussed, the three principles we discussed: alignment, breathing, and control through this progression. They should never have a change in their alignment, their ability to breathe three-dimensionally, and or their control throughout the pattern. That's how you help your client develop a more optimal and efficient strategy for core stabilization. In the next video, I'll show you how to take this into an upright position and some of the more functional patterns that you want to do with your clients, especially those clients that are struggling with core and low back issues.